Hi, everyone. Thank you so much for joining our webinar, Tips and Tools to Successfully Submit the Annual Healthy CPS Survey. We're excited that you're able to make some time to join us. We know the current pandemic is really highlighting the important role our schools play in supporting the health and well-being of our students. So we're just really glad that you're making time to look towards the future. And we are thankful that we can support you in this process. So in the webinar today, it will be myself, Rosa Ramirez-Richter, and I'm the Chicago Programs and Policy Director. And I'll also have my colleague, Kenneth Farner, who's our Community Engagement Manager, join us as well. I just wanted to first do some housekeeping and detail what you can expect in this webinar. It'll run about approximately 40 minutes. We are offering continuing professional development credits if you request it, and you would have to contact Kenneth Varner directly to get that process moving. But it is there should you want to take us up on it. His contact information is at the end of the survey, at the end of this webinar. And the few things that we're going to cover today is really supporting you all in successfully submitting the annual Healthy CPS survey. So what we'll cover is just doing some level setting and explaining what is the Healthy CPS process, and what is different this specific year. And then we'll go through some tips and lessons learned about how to best prepare for the survey, what is the documentation that you'll need to complete it, and who are the key people inside the school structure that can help you best to complete it. And then we'll have some resources and timelines at the end as well. But a little bit about who we are for those who aren't as familiar with us. Healthy Schools Campaign, we are a local national nonprofit, and we work both on the local and national issues around creating healthy school environments. At the core of our mission is we believe that healthy students are better learners, and we really work hard to equip stakeholders on the ground to make those changes, but also leverage what we're learning in our experience with working to you to create systems level changes. So we believe that everything from the school meals that students are eating to the opportunities they get to be physically active to the support that they get in school-based health services or mental health services is key to really having students be successful. And you can find out more about us on our website. And really, when we talk about what is a healthy school? I think we're just really talking about supporting the whole child, that this is a key to a school's mission that understands that there's this interconnection between a student's health and their ability to learn. And they practice this in the everyday school environment, whether that's affording opportunities for students to be physically active or having those school support systems to show that students are supportive and cared for, and making sure they have a clean air to breathe in a school environment, things like that. But also it's about having access to care, including mental health, dental and vision, and chronic disease management. But most importantly, when we think of a healthy school, we hope that students are learning both through lessons and examples that their own health matters and that they are valuing the health of the environment as well. And so to that end, we have worked and are continuing to work with Chicago Public Schools to really put that sentiment in practice, that healthy students are better learners. And so at CPS, through the support of many partners and advocates and parent leaders, CPS has a demonstrated history in terms of their policies to really show that they care about promoting healthy eating and physical activity. And that's mainly through their wellness policy, which really is 4 policies that are referenced in one policy. So there's the local school wellness policy that really just refers to different sections about nutrition education, physical education, school food, and specific criteria around that. Then there's the healthy snack and beverage policy that really addresses, food and beverages outside of the school meal program. So think fundraising, think classroom celebrations, things like that. And the other policy is the breakfast after the bell. This, mandates that all schools, elementary and high school, make breakfast available to students after the bell through a variety of models. And last but not least is the physical education policy that really dictates, what is physical education, how is quality measured, and what are the required minutes for PE contact hours. And so I'm sure many of you are already familiar with these policies, but if you're not, absolutely, you can find these policies on the CPS website and familiarize yourself with it. And so continuing on, again, the way that the district really tries to communicate to schools and parents and the broader community that, the health and wellness of their students matter is through this healthy CPS indicator. And so as you can see, it looks a bit like the Chicago flag, where there are 4 icons, and each of these badges or icons represent different policies that the district has. So the first one is all around whether schools are effectively providing a safe and supportive environment for students that have chronic conditions like asthma, food allergies, and diabetes. And then the second badge titled Instruction is really measuring whether schools are aligning with the requirements for nutrition ed, physical education, and sexual health education. The apple is really measuring whether schools are providing access to physical activity, healthy food during the school day, and much more. Really, a lot of the requirements for the wellness policy are housed in this apple badge. And then last but not least is the health services badge, which is measuring whether schools are providing access to health services that are impacting learning. So a lot of different content and a lot of different criteria and recommendations housed within this, but really the idea is to communicate to schools that this is important and it should be key to your everyday school mission, but also to show parents that these are policies that should be implemented in every school in the CPS school system. And the way that the district really is having the data to inform whether you get this achievement on your school report card, which is released in the fall of every school year, is through the annual survey preparation, which Kenneth will talk about, and we're going to really try to equip you with the best tips and tools that we know of how to successfully complete that. But before moving on, I did want to share a little bit about, really talk about the school improvement plan. We know that for many of you, regardless of, how things are being disrupted given the global pandemic, the continuous improvement work plan is still going forward. And I think this is a great opportunity to really incorporate some of the ideas and sentiments behind, healthy students are better learners. So it really is an effective way that you as a school can stay accountable to yourself to meeting, the health and wellness needs of your students, but also to really build upon the really successful things that you are doing. So we are asking you to really encourage you to really think about, through your planning process, how do you think about incorporating health and wellness in this current process that you're doing? So we're suggesting that you utilize your CPS dashboard, really use your Healthy CPS process from last year or this year in terms of what you were able to accomplish and what you want to build upon in this CIWP cycle, and to really make it sustainable. And to that end, I'm just going to make a plug that we are asking schools, specifically school principals. So if you're not a school principal, you might want to ask your school principal to take the pledge and say, especially given during these times where health is so valuable, is that, to take the pledge that, yes, as a school, we're going to incorporate health and wellness in our school improvement process. And really the goal behind doing this is, one, to raise awareness of that the CIWP should be a place where you're embedding health and wellness goals related to students and the broader school community, and it's really linked to school success. But also to demonstrate that there really is support for looking at schools in this holistic way. So I just wanted to quickly make that plug there. And we do have more resources on our website. There's a toolkit all dedicated to how do you integrate health and wellness into the CIWP. And there's a link. We also, on our website, we have a resource page that is dedicated to health and wellness resources, curriculum ideas, things of that nature. And then we've also created a coronavirus resource hub where, we know that many of you are figuring out distance learning and perhaps even talking to your own children about the global pandemic that is happening. So this specific resource hub is a curated set of resources that can help you as educators in the elementary and high school space as we're trying to recalibrate our plans in this new reality, but also it has resources for parents, school nurses, cleaning staff, and others. So I really encourage you to check that out. So with that, I'm going to hand it over to my colleague, Kenneth Varner.
Hello, everyone, and thank you very much for joining us. My name is Kenneth Varner. I am the Community Engagement Manager with Healthy Schools Campaign. I've been part of this organization for about 4 years now. I'm also part of the CPS's network of partners, and they have entrusted us to work with schools to provide technical assistance in achieving the wellness policies. So I have some information and some updates that I would like to give to you in respect to what is going on with the school closures and how the COVID-19 has affected schools, and as well as how that then relates to the Healthy CPS survey. So the impacts for this year's, normally, the results of the Healthy CPS survey would be put onto the school's website on your progress report. That will not be the case in this following school year, so these results will not be made public. However, the results of this survey will be offered to the schools so that you can use that as guidance for implementing the wellness policies going forward. However, CPS does recognize that this is a lot of hard work that goes into preparing for the survey and implementing the policies throughout the school year. So any school that has achieved Healthy CPS will still receive a banner and recognition on the CPS website. And I would also like to mention that even though the results will not be made public, we still do understand the importance of providing health and wellness to students. So we do not want to use this as an excuse to not implement what we can do and try to maintain the work that we've already accomplished. This year's survey will be abbreviated and it will look a little bit different. It will include required and optional questions. So please pay attention to which one those are as you go through. Also, if you were unable to utilize the school garden as the schools were closed right as the growing season restarted for the spring, you can select that you did not have a garden, and that way you will not be penalized for not implementing the garden during this growing season as schools were not available to do so. Now I want to talk about how you prepare for doing the survey. You want to enlist one person to complete the survey. That can either be the school's administration or the wellness champion. Whoever it is, just make sure that that person is going to be in charge of bringing all the information together and inputting it into the CPS system. A good way to start is to just go over your checklist. There's a link here that you can look into. This would be something that you hopefully would have accomplished in the filled out in the beginning of the school year. So you just want to make sure to see where you're at and where you can find the information that you're going to need to input on the survey. And you want to compile all those answers into a centralized location. I know this is going to be a bit more difficult given the current situation. I would recommend making a Google sheet where you can still solicit information from different people that you're working with in order to compile all that information so that you can enter everything into the survey in one sitting. So just making sure you're just gathering all the documentation and everything else that you need into one place. So there's going to be certain documents, as also done in the past, that CPS is going to be requesting that you upload as part of the survey. So that's going to be a nutrition education lesson. This should be a lesson that was actually used in the building, not just going and Googling something that has to do with nutrition education, but something that you actually implemented in the school and have some way to some evidence that shows that it was actually incorporated into the curriculum. You'd also want to have the sexual education notification letter that goes out to guardians, and that should be an opt-out letter. I'll go into a little bit more specifics later on. And then you're also going to want a student medical information form. It must be redacted. We do not want to put out anyone's personal information, but you should be using something that was actually filled out by a family and giving back to the school. So you want to make a copy of that, take out all the sensitive information, scan that and upload that, include that part of the survey. And I'll give you an example of that in a moment. So here's an example of the sexual health education opt-out letter. Sexual education must be taught to all students every year unless their guardian requests otherwise. So if you hear nothing back from a family, that means that student will be receiving sexual education. And CPS has said that sexual education can be provided as part of the distance learning curriculum. So if you are able to, please still do provide sexual education. You see this arrow that is going to be pointing to the section of the letter where it is telling parents that they have the option to request that their student not be a part of the sexual education. And if you do receive that from families, then you can remove that student from those lessons, and then you can excuse them from those lessons. But again, this should be a letter that is saying that the parent has the option to opt their student out of this lesson. So here's an example of the student medical information. This is one that I just made up because, again, we do not want to have anyone's personal information out there. On the left, you will see something that was given to you by a family that was filled out. They returned it to the school. The right is going to be an example of what you want to have uploaded to the survey. You want to take out the student's name, their date of birth, their identification number, the parent's personal information. All you really want to have on there is the school name, the grade that student was in, and the date that it was signed. And make sure that you are uploading this year, so school year 1920, student medical information form that will be going on there. And when completing the survey, make sure that you have all the information that you need. If you are not an administrator, principal, or an assistant principal, please make sure you are reviewing all of the questions with the administration before submitting. So you want to upload all the required documents that I just went over to the device in which you are going to be doing the survey on. And then when you're going to complete the survey, the answers are automatically saved. So if you have to stop for any reason, you can come back to it. However, things do happen. Information does get lost. So I would recommend doing it all in one sitting if you can. That's why it's really important to combine all of the answers and everything onto the device that you're using. So getting all of the documents together so that you can do it in one sitting to leave the least amount of room for mistakes. And once you do submit the survey, it cannot be edited once that happens. So once it is submitted, that is it. It goes to CPS. So make sure you have everything together so that you can do it in one sitting. Make sure that you speak to everyone that you need to speak to get all the correct answers as well. So in respect to that, you want to take care when answering your questions. There's going to be a part of the survey where it's going to ask you to select the grades that your school teaches. So you want to make sure that you select all the grades that are taught in your school. If you do not select the correct grade, you will not get certain questions will not populate into your particular survey. And that will end up like giving you bad results on the end. So you want to make sure that you answer that part correctly. Also, the food ordered from the CPS catering menu does not count against you. So if you had any celebrations or anything, class parties, that will not count as one of your out of one of the 2 days that you get to have a unhealthy celebration. So just keep that in mind. And like I said earlier, please consult all necessary personnel when answering the questions, even if you don't think that that person might have something to add. Please look into as many people as possible. An example of that would be the school nurse, the case manager, the PE teachers, the lunchroom staff. Sometimes they are aware of certain situations that are going on in the school that you yourself may not be aware of. So it is best to touch base with everyone involved as much as possible. I realize this is like a trying situation, but please, as much as you can, speak to the other staff members and administration at your school. Please consult everyone just in case they do have something to add that will be relevant to the survey. Now, the timeline on April 6th was the release date for the Healthy CPS survey. Here you will find a link to the survey. This will just be for your reference only. The administration and the wellness champion should have received an email that would have your personalized link to fill out your particular survey for your school. The final day for you to submit the survey is April 24th. So you want to make sure that you have it in by that day. And over the summer, CPS will release the results to the schools for you to review. And again, it will not go on the public-facing report, but this will be a great way for you to see the work that you've done this year and what you can improve upon for next year. This is going to be a list of partners that you can lean on for the rest of this school year and going forward. These are all partners that have been vetted by CPS and can help you provide things like physical activity, recess help, and as well as sexual education. Some of these partners may also be available to provide this through the remote learning program. We have a list of resources for you here. You can go to the Healthy CPS homepage if you are looking for a bit more details. Again, as Rosa mentioned, we do have our school improvement plan toolkit. And again, just for the ease of having everything in one place, I've also included the Healthy CPS survey for this year for you to use for your reference, just so you can go through and see what questions are being asked to help you bring all that information together. If you have any questions about the survey, please feel free to email me. I can be reached at kenneth@healthyschoolscampaign.org. And if you want to reach the Office of Student Health and Wellness, you can go to oshw@cps.edu. These links are active here, so you can simply click on those. Yes, and the email address for the Office of Student Health and Wellness goes to the entire staff. So whatever question you have, feel free to put it in there and they will make sure that it gets to the appropriate person to answer that question. But again, if you reach out to them and for whatever reason the question is not answered or you're having trouble getting through, please reach out to me and I'll do the best that I can to make sure that you are taken care of. With that, I would like to thank you very much for attending this webinar. Good luck with the rest of the school year and stay safe and stay healthy.